So we'll start with the first one, nutrition. Ayesha will talk about this. Her area of research is this. Okay.
Thank you, Dean. Okay, let's talk about nutrition. So as researchers, I always get excited about data, and I think every statement has to be supported with data. And we don't have a lot of time with you guys. I could spend days with you just showing you the data that supports the importance of nutrition and brain health. But we picked a couple of papers, some really relevant papers, to show you, what kind of diet actually affects brain health and prevents Alzheimer's disease. And I think it's important for us to be data-based, first of all, and discuss this on a regular basis because there's a lot of noise and clutter and confusion out there. Everybody's coming up with a diet of the day and, the vitamin of the day, but that is not so. So, unfortunately, this is what our diet looks like. It's highly processed, mostly animal protein and animal fat based, and has a lot of processed sugar. And we want to change it to something like this, a whole food, mostly plant-based diet. Now, let's go over some of the data. This paper that was published back in 2002 actually showed the effect of vascular risk markers, things like blood pressure and cholesterol on brain health. About 1,450 participants who were 65 to 79 years of age were studied. And these individuals had ApoE4. ApoE4 is a genetic marker for Alzheimer's disease. And it was found that people who had ApoE4, they had a higher risk for developing Alzheimer's disease, almost twofold. So their odds went up by twofold. However, if these individuals had high cholesterol and high blood pressure during their midlife, those markers actually increased their risk for Alzheimer's disease more than what the genes did. Vascular risk markers are actually a higher risk for Alzheimer's disease compared to genes. This study that came from Rush University, the Chicago Health and Aging Project, it was a longitudinal study, which means that people were followed for many years, 2,500 older adults, and it was found that people who consumed higher amounts of saturated fats that are derived from animals and trans fats, which are found in junk processed foods, over a period of 6 years, actually had a higher risk of developing Alzheimer's disease compared to those who ate fats that were derived from plants. Think of nuts and seeds and avocados. This study, the Adventist Health Study, from where we come from, Loma, Linda in Southern California, back in 1993, Dr. Paul Guillaume, a researcher, was interested in finding out the incidence of dementia in the Adventist population. Now, the Adventists have 50% vegetarians and 50% omnivores, or people who eat meat. And he wanted to know, what was Alzheimer's incidence like in that population? And he found out in a group of about 3,000 individuals in that study that people who ate meat, including those who ate poultry and fish, had twice the risk of developing Alzheimer's disease compared to vegetarians. This study, the Kaiser Permanente Northern California group, in about 10,000 individuals, they found out that people who had high cholesterol during their midlife had a 57% higher risk of developing Alzheimer's disease. And even borderline high cholesterol increased their risk by 23%. So, there are a lot of people who go on with not really bothering too much about lowering their cholesterol level because it's, not that high. It's just kind of in the middle region. No, it's important to lower your cholesterol as much as possible, especially during midlife. The vascular risk factors in midlife seem to have a higher association with development of Alzheimer's disease later on. This study, in the Women's Health Study from Harvard University, 6,000 women followed for 4 years. Higher saturated fat intake was associated with a poor trajectory of cognition, which meant that they had a faster decline in their cognition compared to those who consumed fats from plants. And when they did imaging studies of these women, the women who had the lowest intake of saturated fats actually had a better looking brain. Their brains looked younger, and they did much better in neuropsychological testing. Their brain function was that of a woman 6 years younger. This study, I had the privilege of working with my mentors at Columbia University, and it was found that people who ate a plant-based diet which negates sources of saturated fats, they had a lower risk of cognitive decline over a span of 6 years compared to those who ate a standard American diet or a SAD diet. Rush University Memory and Aging Project, same pattern. Do you guys see the pattern here? So the scientists at Rush University were interested in the MIND diet. Anybody heard of the MIND diet? Great. So the MIND diet is a hybrid of Mediterranean diet and DASH diet. DASH diet is one that is high in plants and low in salt and sodium. And Mediterranean diet, well, I'll explain about what that means later on. Essentially a diet that is high in unprocessed plant foods. It's not fish and cheese and wine and, some Mediterranean music on a lake. We'll talk about that later. So people who adhered to a MIND diet had a lower risk of Alzheimer's disease by 53%. Crazy numbers, isn't it? It's so amazing. And even moderate adherence to a MIND diet reduced their risk by 23%. And people who were adherent to this diet, who had the highest adherence, actually had a cognitive function equivalent to a person who was 7.5 years younger. So functionally, their brains were better, and they had reduced risk of disease too. Now, I was intrigued by the concept of Mediterranean diet. I wanted to know what it was, because we hear it a lot, don't we? Everybody's heard about the Mediterranean diet, haven't we? You see it on the news, you see it on magazines. Everybody wants to go to the Mediterranean region and eat Mediterranean diet. By the way, it's not like that anymore. It used to be. Unfortunately, it's not like that. It's been westernized. So I had the opportunity to work with this large database, about 133,000 women that were followed for about 25 years, the California Teacher Study. And what I did was to find out, what is the association between Mediterranean diet and incidence of stroke. And when you break down the Mediterranean diet score, this is what it looks like. You get a high score if you eat vegetables, fruits, whole grains, nuts and seeds, legumes, and omega fats, omega-3 fatty acids, not necessarily fish, but omega-3 fatty acids. It could be derived from plants too. And you get a low score if you eat meat, poultry, and dairy. And what are those? Those are sources of saturated fats. Right here. And what I found was incredible. Every step of getting closer to a Mediterranean diet lowered the risk of stroke. And we all know now that people who tend to have stroke have a higher risk for Alzheimer's disease and vascular dementia as well. And it was interesting because it was not an all or none phenomenon. Either you eat a Mediterranean diet or you don't. No, every step of getting closer to that optimal diet, which is essentially a whole food plant-based diet, made a big difference in lowering stroke risk by 44%. And this is just diet. We adjusted for exercise. We adjusted for education levels, for stress and things of that nature. Just diet on its own. What medication do we know that shows us numbers like that? Nothing. There is no other medication. Let's talk about supplements. Dean and I work in a clinic. We used to work in Beverly Hills where people would come with bags and bags of vitamins and minerals and so on and so forth. And they would ask us, so what about this vitamin? What about this blue jellyfish thingy that I saw on, infomercial last night for brain health? And most of the randomized controlled trials on nutritional supplements for Alzheimer's disease prevention have been inconclusive, except for 3. Number 1 is vitamin B12 level. Vitamin B12 level has to be replaced in deficiency states, and it has been associated with better brain health. The second one is DHA, omega-3 fatty acids. But we always say, skip the middle fish, because fish comes with a lot of junk and a lot of toxins. So it's always best to go to the source, which is algae. So an algae-based DHA is important for brain health. And then the third one that is relatively new is turmeric. We actually did clinical trials, and we wanted to study the amount of amyloid in the brain at Cedars-Sinai in Los Angeles to see, the amount of amyloid through the retina. And when people were given high doses of turmeric, it actually bound to that amyloid protein. And there's research that shows that the amyloid load in the brain actually is lowered when people take curcumin on a regular basis. Curcumin is a part of turmeric. There's so many different compounds in turmeric, but curcumin has been studied. So it looks very promising, and we push that. It's a very potent anti-inflammatory. The rest of them, they're inconclusive. We don't have any data that shows that any other vitamin is good for the brain. And we always say, why don't you just get all of your vitamins from whole foods? It's much better because it's the synergy between these vitamins and these nutrients that make a difference. And there was a study that was released a couple of years ago, and they found out that vitamin B12 and omega-3 fatty acids, the DHA, actually work in synergy to show its benefit for brain health. If one is low and the other one is high, or vice versa, they don't work as well. So the body recognizes it in whole food forms. Are you okay, sir? I'm sorry about that. All right, let's talk about fish. I mean, we always hear, fish is great for brain health. Fish has great fatty acids that are necessary for brain health. I wanted to start this conversation by saying that whenever fish is studied in different studies, it's always in comparison to something. You always compare what you eat now to what the nation eats, Unfortunately, we eat a standard American diet, which is mostly processed. So fish, which is lower in saturated fats compared to, say, red meat or chicken, always seems to be better. But if you compare fish to lentils, which hasn't really been studied at all, I don't think you're going to see any benefits. It's the whole food plant-based diet that, is way better than all of these animal sources. And most of the studies actually haven't shown any benefit for cognitive function with fish consumption, or even with omega-3 supplementation in studies among healthy older adults. People who have lower omega-3 fatty acids, it's important for them to be replaced. And we all know that fish and, most of the animals in the oceans have been contaminated with mercury and PCB, and there's so many publications about that here. And these are neurotoxic. We don't go to our doctors to get checked for these toxins, except for maybe mercury and lead. But there are, thousands and thousands of other chemicals in the ocean that we never ever check. So skip the middle fish. It's important to get an algae-based DHA and EPA supplementation and to get our nutrition from plant-based sources. This is a paper that Dean and I published a few years ago about dementia and diabetes relationship. Now, anybody heard of Alzheimer's being type 3 diabetes? I mean, okay, that's interesting that a lot of you have heard it. I think it's a misnomer. Yes, diabetes or glucose dysregulation is a path for Alzheimer's disease development, but it's not the only one. It's just one part of the picture. And in this paper, we found out that people who have diabetes, they actually have a higher risk for Alzheimer's disease. But in this paper that was published a couple of years ago, we found out that people who don't even have a diagnosis of diabetes, but they have consistently high glucose levels, which is a lot of us, because of processed foods, because of, the instant, rush of sugar that we see everywhere and the consumption of sugary foods, that actually raises our insulin and we get insulin resistance. So insulin resistance has been associated with cognitive decline as well. So one shouldn't wait for us to have a diagnosis of diabetes to be careful. It's important to pay attention to insulin resistance. And what causes insulin resistance? Mostly saturated fats and processed foods. All right. And so to kind of come to a conclusion of what an ideal diet for the brain looks like, it's a whole food plant-based diet. And one should work towards elimination of meat, poultry, and dairy. Now, we believe in progress. Sometimes these statements seem harsh, especially when we actually work half a day in a community clinic where people mostly don't have any access to health care, they don't have health insurance. And for us to go there and ask people to become, whole food plant-based overnight, that's not going to happen. There are people who don't even know what beans are, and they live off of fast food because they're so busy raising a family. So as far as progress is concerned, find out where you are today and go towards the next step of that optimal diet. I think that's the most important message that we have to give to communities. Specific consumption of certain foods are great for the brain. What are they? Greens, berries, and beans. Greens, because they're an incredible source of anti-inflammatory compounds, berries as well, and beans have complex resistant starches that are a great source of energy, protein, and they also keep sugar in your gut. They have what we call the second meal effect. Say, for example, you ate a bean burrito in the morning, which is fabulous, but then something happened. By accident, you had a donut. We're not going to go into the details of it. Now, the beans in the burrito actually keeps the sugar in the donut inside your gut, and it doesn't let it go into your circulation to cause a sugar spike, where your brain just goes haywire and it causes inflammation. So eating beans on a regular basis is one of the best things we can do for our brain. And if we look at the blue zones in the world, these are areas that have the longest living populations, who have the least amount of disease, including dementia. One of the most important factors in the diet is beans. All right. So an everyday meal would look like something you guys had for lunch today. Green leafy vegetables, cruciferous vegetables, other vegetables, berries, nuts and seeds, beans and lentils, whole grains, herbs and spices, tea and coffee. And then working towards eliminating sugar. And when I say sugar, sugar not in fruit, because that is actually bound with so many vitamins and nutrients and fiber. This sugar is the white sugar that, we see everywhere and in pastries and sweets. Cheese and dairy, because they're a very high source of saturated fats, and extracted plant oils, especially tropical ones, coconut oil and palm oil, because they're more than 90% saturated fats. It clogs the artery the same way that saturated fats from animal products are concerned. So, in summary, whole food plant-based diet prevents neurodegenerative diseases of the brain and neurovascular diseases as well, like stroke. Saturated fats are associated with insulin resistance and inflammation. And sugar consumption, pure processed sugar, is associated with inflammation in the brain.